Hello, this is Dr. Daniel Farkas, DC CFMP, and I want to cover something important today that has everything to do with your nervous system, your gut, your immune system function, your mood, your behavior, sleep, virtually everything. It's the gut-brain connection. So many of you have heard of this. If you've been around me, you certainly have heard of the gut-brain connection, but understand that um, the gut and the brain, they're like a married couple, if you will. They're supposed to be communicating well and getting along very well and carrying on successfully together. But what can happen, because we live in a toxic, stressful environment that creates a lot of dysfunction in the gut, especially certainly in the brain as well, through all the device use, electronics, the depersonalization, the expensive, just difficult ink stress increase that's out there just waiting for us every day. In addition to that, the gut, the poor gut, we live in an environment that's very hostile to it. Pesticides, plastics, beauty and hygiene products, food colorings, dyes, water pollution, all that. All this, it makes it so that the gut just struggles terribly. And the gut is responsible for so much. It's responsible for breaking down our food and controlling what gets absorbed into our bloodstream. So it needs to be a happy place, and it's got really important work to do, as does the brain. And so the brain is busy. It's trying to take care of everything going on in the body, run the immune system, create, regenerate things, adapt to the environment, hot, cold, grow, and age and dodge problems, and manage all the systems of the body, the cardiovascular, the respiratory, the digestive, the endocrine, all that. It's very busy, but then again, we have the gut too, whose job is to break down food, digest food, deal with pathogens, deal with problematic characters showing up in our food that just don't belong there. They're unnatural, that even 100 years ago weren't even there. Like the things I mentioned: pesticides, plastics, beauty and hygiene products, food colorings, dyes, water pollution, bad oils. These things weren't there, insulting the gut and causing serious dysregulation, imbalance, and damage, frankly, to the crucial bacteria that live in there. Now, pretty much everyone knows there are trillions of bacteria that live throughout your gut, but understand this. Those bacteria, they communicate with the brain. The bacteria talk to the brain. They communicate to the brain. They give it information about how it should act, how it should behave, what chemicals it should release, and super important, really, how well it should run the immune system. So the brain is listening constantly to the gut, and it's receiving information in a couple ways. It's receiving information from the chemicals that the bacteria release that get into the bloodstream, that circulate around and get up to the brain. But also, crucially, it's listening along the course of a nerve you might have heard of called the vagus nerve, VAGUS. That is the gut-brain connection. I always say we don't run on Wi-Fi, not yet. We run on hard wires, and our brain communicates with our gut by way of the vagus nerve. So just imagine if the gut was healthy, balanced, super happy, just all the bacteria are balanced, the inside lining of the intestines is very strong, and it's very discerning, and it's very snooty, very picky about what it allows in the bloodstreams. It keeps those pesticides, plastics, beauty and hygiene products, food colorings, dyes, water pollution, and more. It keeps those out when it's working properly. But now imagine what commonly happens. The gut dysfunctions, the bacteria are scattered all over the place through things like antibiotic use, all those chemicals, the pesticides especially that I mentioned. They're signaling terrible, who knows what bad news to the brain. The brain's going haywire. And also the lining of the wall of the gut. The inside of the intestines is broken down, damaged. That's just allowing anything and everything into the bloodstream. Just imagine all this is going on, and now imagine what it would do to the relationship of the gut and the brain. They're not getting along. Just like two parents that are trying to run a household, have jobs, take care of kids, manage a home, pets, their own personal health, fun, all those things. Now just imagine that one or both of the parents is severely dysfunctional, having severe problems. Not for lack of trying, but they're really struggling. They're really falling apart. What effect would it have on the other one? So just imagine what serious digestive problems, even moderate digestive problems, do. Bloating, constipation, diarrhea, gas, acid reflux, or more serious problems, serious inflammatory bowel disease, serious problems with pancreatic enzyme, digestive enzyme, bile production. Just imagine it. Imagine the effect that it has on the brain. And you wonder why more systems in the body are insulted and are acting poorly and acting bad because, again, this crucial relationship between the brain and the gut gets violated. Then you could throw on top of the brain the stress of life, especially device use. And I'm sorry, you're probably watching this on a device that I'm talking about, but I say everything in moderation. Devices are great. They bring the knowledge of the world to us, and we can learn great things from them, but sometimes they get abused, and it has come to light that many platforms, especially social media platforms, are designed to frankly get control of our brain and give us little dopamine hits all the time that keep us addicted and scrolling, or what I call doom scrolling. That is something that's so unhealthy for the brain and for your spirit. Actually, it's junk food. It's serious, bad, the worst kind of junk food for your brain. And this is common, these problems I'm talking about. Everybody gets exposed to those pesticides and those things I named. Virtually everyone is impacted by device use. So now you have a brain and a gut that aren't getting along. Now the problems, the symptoms really start up. Anxiety, depression, sleep problems, digestive problems, hormone problems, immune system problems, big time. So what do? I've always found, me, I always say don't guess, do a test. I always found that when you do some testing on people that have, those types of problems or worse, they have serious like heartbeat irregularity issues. They have conditions called POTS. That stands for positional orthostatic tachycardia syndrome. That means when they stand up, their heart rate just goes through the roof and they feel real bad, anxious all the time. They can have serious skin problems like something called chronic urticaria, which means every time they exercise, they get painful rashes. And like I say, the emotional, mental health problems can really, really get bad. So when I see these issues, I'm like, wow, what is going on? I sure am curious now of a couple things. Number one, what's going on in the gut? What's up with the bacteria? What's up with the lining of the gut? Like, what the heck is going on in there? But then also, how is the brain working? How is the brain working and how is the brain functioning? Is it struggling? And how can you measure these things? So again, I always say don't guess, do a test. I love doing brain and vagus nerve health assessments on people, where they ask them to do simple things like, can you even gargle water for 30 seconds? Can you hold your breath for a minute? Can you do some simple balance exercises with your eyes open and closed and like a simple brain tease or a puzzle? Young people, barely out of their teens, all the way up to old people past retirement, some of them are stunned with how bad they struggle with these simple things. And they say, what's wrong with me? And I say, don't worry, you don't have, brain or nerve damage. What you have is a serious imbalance in your nervous system, but don't worry, it can get restored by and large. Just like a weak muscle, just like a weak bicep. If you broke your arm and you had a cast on your arm for 2 months and they cut it off and your arm looks all thin and weak, that can be rehabilitated, and so can this balance, this communication between the brain and immune system, right? And the gut, of course, too. I look at the brain and the immune system these days. They kind of lump them together. They call it the neuroimmune system. So this relationship between the immune system and the gut, it can be rehabilitated, just as the inner lining of the gut can be healed, and the bacteria can be brought back into better balance with proper antimicrobial use that kills off bad guys, and then proper stair-step probiotic use, along with some lifestyle support, major do's and don'ts, and maybe some, significant, effective, hard-hitting natural anti-inflammatories, and you can see changes in people. I'm just telling you, I don't want to make you feel bad if you have any of these things. These changes don't take years. They take more than hours and days, of course, but in a relatively short period of time, you can start to tip the needle back in someone's favor and watch their digestive problems improve, watch their anxiety, depression, and insomnia issues get better. Certainly digestive problems and immune and more, but if this gets ignored, they just kind of keep on kicking through life, medication, hospital stay as their diagnoses just kind of evolve and they suffer and they wonder. And I've seen doctors who have this too as well. Very accomplished, very educated doctors, educated in other fields, but you can't be a doctor of everything. And I'm modest and humble. I stay in my lane, but I find that these are problems and situations you can really help people out of. So I'm glad that we walked through this. Thank you for being with me as we just walk through this thought of this brain gut connection and what happens when they're not getting along and when they're both struggling, but also what can happen if you can get them both on track. You can restore peace, you can restore harmony, you can restore balance in the body. You can start to lean away from medications and frankly get towards actually optimal, health potentials and truly be healthy, or what I call really healthy. So I'm Dr. Daniel Farkas. Be well.